Hello, this is Dr. Raghavendra from Raghav's Medical Center, and today I'm talking about osteoporosis. Osteoporosis is a weakening of bones which happens with age, but it can also be due to drugs like steroids. So, it is important to monitor the bone strength of elderly patients after a certain age, because after a certain age, patients are prone to fractures like wrist fractures, hip fractures, vertebral fractures. Why this is important is that if you know that the patient has weakened bones beforehand, then you can start medications to prevent fractures. There are very effective medications as of date to increase the bone strength of patients. These are available both in oral formulation and as injections. So, who to screen? How to determine the bone mass of patients? How to determine who is susceptible to fractures? So, the test that is done is bone mineral density by DXA. Dual X-ray absorptiometry is the test, and what is being checked is your bone mineral density. The result comes as a chart with your T-score and Z-score. A T-score less than 2.5 is suggestive of osteoporosis and definitely needs treatment. So, who to do this test for? Any patient above the age of 50 years who has sustained a fracture needs a BMD. Whether the fracture was after a major trauma or a minor trauma, this doesn't matter. Women above the age of 65, they definitely need to be monitored by using DXA at least once in 2 to 3 years. Men above the age of 70 also need to get their BMD test done. Coming to patients who have had vertebral fractures. Any vertebral fracture, whether it was symptomatic or asymptomatic, after the age of 50 definitely needs a DXA test, DXA and BMD test. Vertebral fractures may not always be secondary to trauma. Osteoporosis induced vertebral fractures can be asymptomatic. The patient may not have any acute onset of pain. He may only complain of vague abdomen distension or a vague back pain, etc. So, one way to monitor if the patient has sustained a vertebral fracture is to regularly check the height of patients at each visit. If the physician notices that the height has decreased or there is a change in the posture of the patient, if there is forward bending of the spine, then without any hesitation, an X-ray of the dorsal spine and lumbar spine, especially the lateral view, has to be done. Vertebral fractures are often treated conservatively without surgery, but the presence of a vertebral fracture is definite indication to start the patient on bone strengthening medications. Most commonly used are bisphosphonates.